Thank you. Thank you and welcome for tonight's presentation of healthy caregiving, understanding and managing the pressures of caregiving. I'm Andrew Stambach, and I'm so happy to be joined tonight by Colleen Farrell, who is a co-facilitator of the Share Caregiver Support Group, which meets on the first Tuesday of every month on Zoom. We're delighted to have Sam Fortune with us tonight, who will be giving us her presentation. I also want to acknowledge before we begin the vital role that Alicia Gangataran has played in getting this program up and running. Just a brief announcement before I introduce Sam. The video and presentation will be recorded this evening. However, the discussion and question and answers will not be recorded. The video and presentation should be available on the Share website in approximately 1 to 2 weeks. During the presentation, feel free to submit your questions via the chat function, and they will be answered at the end of Sam Fortune's presentation. So tonight, right now, I'd like to introduce our speaker tonight. Sam is an oncology social worker at Cancer Care who provides counseling and support for patients coping with cancer, for caregivers of cancer patients, and for people who have experienced a loss of a loved one. Samantha has assisted in the programming and the outreach of Cancer Care's Women Cancers program, and she has participated in several national presentations and has been a speaker in many cancer care education workshops as a leading expert in the field. It is my great honor to introduce to you Sam Fortune.
Thank you, Andrew. Hi, everyone. As mentioned, my name is Sam, and I'm an oncology social worker at Cancer Care. I'm going to share my screen to show the PowerPoint. Let's see. Can everyone hear me okay?
Yes.
Okay. I'm going to start. As mentioned earlier, feel free to ask questions in the chat, and then I will definitely answer all questions at the end. But yeah, feel free to ask any questions away. So as mentioned, I'm going to be going over healthy caregiving and understanding and managing pressures of caregiving. Okay, trying to move this. Okay, so some of the learning objectives we're going to go over is defining what a caregiver is, providing information on common caregiver challenges and stressors, exploring ways you guys can cope as caregivers, and of course, at the end, having an open discussion about caregiving and any questions you have. So defining what a caregiver is. So being a caregiver can look, feel, and mean different things for different people. So my interpretation of a caregiver is like anyone who's providing care to a loved one can be considered a caregiver, even though some people may not feel that's like a definition of a caregiver. But as long as you're providing any emotional support or physical support, I consider that as caregiving. And as mentioned, caregiving can be informal, done by family or friends, or by formal, be done by professionals. And then caregivers can be local or in the household, or they can be long distance caregiving, meaning you guys live in another state or another town. As long as you're providing support and coordinating appointments and things of that nature, I do consider that as a caregiver as well. And caregivers, as I mentioned earlier, tends to provide emotional and practical support. Okay, who are caregivers? So in 2020, there are about 53 million US adults who are caregivers. And at least 1 in 5 people in the US are caregivers. 49.4% is the average age of caregivers. And as you can see, there's different age range of different people who are caregivers. So the most popular age would be between the ages of 50 and 64. But as you can see here, different ranges throughout. Okay, what does the cancer experience of the caregiver look like? So cancer caregivers tend to have a shorter yet more intense caregiving experience compared to those caring for loved ones with other illnesses. So usually cancer caregivers provide care for about 1.9 years to their loved ones. And 67% of cancer caregivers provide care for less than a year. And this statistic really stuck out to me. The average weekly amount that people spend providing caregivers for cancer patients is 32.9 hours per week. So honestly, it's a full-time job if because usually full-time is considered 35 hours a week. So the fact that a lot of cancer patients, cancer caregivers are providing hours for 32 hours a week, that's a lot of time. And then 32% provides caregiving 41 plus hours per week. And then 43% of caregivers are helping assisting with medical tasks without any training or preparation, which I think is a lot too. And then 52% of cancer caregivers state that they feel they have no choice into being a caregiver, which must be very losing like a lack of control and frustrating that too. Okay. Cancer caregivers often provide both emotional and practical support to their loved ones. So, as a caregiver for cancer patients, you're usually their emotional sounding board, and you're helping them go through either their treatment, their feelings, their fears, which can take an emotional toll. And then, usually, nearly half of all cancer caregivers help their loved ones with 3 or more daily living activities, which we call ADLs. So that means eating meals, getting dressed, getting them in and out of bed, helping them to the bathroom, and daily tasks, which can take a lot of time as well. Okay. And these are some of the challenges and stressors that I've noticed a lot in caregivers that what they experience. So some of the common stressors are emotional stress. Like I mentioned before, hearing your loved ones in pain, seeing them struggling a lot, that can take a toll. And especially seeing it on a day to day basis, that can impact a lot of caregivers. Financial strain. So, normally, caregivers who have to help their loved ones either have to stop working, reduce work hours, and then their loved ones as well has to stop working completely. So then even though both of you guys stop working, there's still bills that have to be paid and there's still a lot of financial burdens. And usually that falls onto the caregiver because oftentimes the person with cancer has to focus on getting their treatment. So that's something that I notice a very common theme throughout. Learning how to perform certain medical tasks. So, like for example, wound care or helping someone after their treatments and assisting after surgeries. A lot of the times it is up to the caregiver to be providing those at home services, which can be stressful. As I mentioned earlier, helping loved ones with the day to day activities and having that the person with cancer usually feels frustrated because of the lack of independence. And then the caregiver also fears that lack of independence because they always have to try, feel like they have to monitor patients, which can take a strain. And then that leads to like the strain between like family and friends because you feel like either all that pressure relies on you or you feel lack of support because not as much people want to help out in that circumstance. Um, and you're also in charge of coordinating services and appointments. So all that planning relies on you in addition to already taking care of your loved ones. You also have to worry about when are their doctor's appointments, making sure you're coordinating transportation, things of that nature. Workplace issues. Sometimes some jobs are not as understanding with you taking time off or you having to take time off. Or I know some caregivers who are working full time and then have to worry about managing being there for their loved ones. So that can take effect. Fatigue and burnout. And I'm going to touch upon that a little bit later, but a lot of fatigue and burnout is very common for caregivers, especially if the caregiving continues for like between 5 and 6 months. That's when I notice a lot of caregivers start to feel the burnout. Poor physical health. Because you're helping taking care of your loved ones, you're not taking the time to take care of yourself. So then a lot of the needs get lacked too, like in case, like following up with your own doctor appointments, eating healthy, things of that nature. And then learning how to balance the caregiving responsibility and personal responsibilities. I notice a lot of caregivers, they struggle with finding that balance and they focus solely on the cancer patient. And because of that, they're not taking care of themselves. Okay. And in addition to other challenges, there's a lot of psychosocial issues that occur for caregivers during this time. 50% of cancer caregivers report high emotional stress, and then the financial stress, which I mentioned earlier. While coping with their own feelings about the loved one's diagnosis, caregivers often provide emotional support to their loved ones, which can be overwhelming. So, usually, caregivers are sometimes very worried about their loved ones because we don't know how if the cancer is going to progress, if they're going to get better or worse. And then they have to deal with not only their fears, but then I feel a lot of caregivers feel like they have to be strong for their loved ones while their loved ones are scared or they're dealing with their own anxieties. So I notice a lot of times caregivers don't even express how they're feeling and they hide it and try to show like they're strong in order to provide that emotional support for their loved ones. But at times too, it can take a toll because it's kind of, I call it like you're suppressing your feelings. And at one point, it builds and builds and builds. And I'll address that more too with the burnout part component. And then caregivers share they struggle to relate to other family and friends who are not in a similar position. So from the caregivers I work with, a lot of them talk about how their family doesn't really, or their friends don't understand when they don't have time to spend with friends, or they may be more distant because they have appointments and things to plan. And because of that, they feel a little bit isolated and they feel that their friends or families don't understand the struggles they are going through, which cause them more to kind of retreat. And then caregivers, especially those who are who are caring for those with advanced stage cancer, find them struggling with anticipatory grief. And anticipatory grief is kind of anticipating a major loss. And when people are struggling with that too, there's that level on feeling on edge or anxiety because you don't know what's going to happen next. And that impacts how you respond to the people you're caring for as well. And then, as I mentioned, talked about earlier about the feelings of isolation because you feel like your only purpose is taking care of your loved ones and you don't have time for yourself. And then, if you feel like people don't understand, you feel more alone. And that causes a lot of people not to reach out for help or to talk to people about their stress. And then caregivers often feel guilty for many reasons. For example, they feel like they're not being a good caregiver, not providing enough support, or wanting to have a break because they feel like they shouldn't want a break because the person with cancer is suffering. So, because that person has cancer and they're suffering, they feel that they shouldn't feel guilty if they want some time for themselves or if they don't want to be there present 24/7. Okay. And then I just want to highlight some common anxieties that I notice a lot of caregivers express. So fear of reoccurrence. So usually some people who are in treatment and the treatment ends, there's that underlying fear that the cancer can come back. And what does that look like if the cancer comes back? Another anxiety I notice a lot is a lot of people get overwhelmed with the too many obligations and tasks. So if there's like a lot of doctor's appointments, coordinating that, coordinating feeding schedules or things of that nature, a lot of people get overwhelmed and anxious because they feel like there's never enough time in the day to do everything. And especially people with families, they also have to worry about their family obligations in addition to be caregiving, and that can take a toll. Loss of control. So with cancer, we don't have control of that situation. Unfortunately, cancer doesn't care who you are. It comes and doesn't discriminate. And because of that, a lot of people feel, and cancer also changes people's lives. And because of that, people don't feel like they're in control. And especially true for caregivers, because they feel like no matter what they do, they can't get ahead. The fear of the unknown. And this also relates to the fear of reoccurrence, the fear of the cancer advancing, or the fear, especially if someone's in advanced stage, the fear of someone dying and then how life is going to look like afterwards. And those fears also plague a lot of caregivers. And I know some people, like, they struggle with sleeping at night because these things are on their mind often. And then concerns over loved ones' mental or emotional health. I know some caregivers struggle with seeing their loved ones suffering or even not saying anything at all. So, like, there's some cancer patients, as a way to cope, they keep a lot of feelings to themselves, and a lot of caregivers worry because they're like, I don't know how my loved one is feeling, and that puts stress on them because they feel like they have to try to make their loved one happy. And I see a lot of people stressing to make sure that their loved ones are happy, they have everything they need, but they do it at an expense to themselves because they try to overcompensate for feelings they have no control over, and not having enough support or time. And this goes back to the point I was referring to earlier, because your life revolves around taking care of the loved ones. There's not a lot of times people schedule for themselves, and there's guilt for that. So then they focus all their time on helping them, and there's not that space. And then because of that, their time feels overwhelmed because there's so much things to do. And then, as I mentioned earlier, the anticipatory grief and that lingering fear of what's going to happen if something happens to my loved one. And then now I'm going to talk a little bit about like burnout and compassion fatigue. So the definition of burnout, which is also known as compassion fatigue, basically means that it causes you to act less caring than you normally do. And this also leads to feelings of guilt or anxiety. And then it can basically leads to poor outcomes of how you take care of yourself and your loved ones. So, for example, and I'm going to go on the next slide a little bit, like what burnout looks like for some people. But like I mentioned earlier, a lot of people notice burnout usually between like 4 to 5 months in the caregiver journey. And it's because it's, I always say, usually when you start the caregiver journey, and this is for a cancer patient too, everyone is on a full tank. So you're hopeful, you're motivated, you're focusing on making sure the person has everything they need, and you're hopeful treatment's going to work. And then as the time goes and it feels like it's never ending, and you keep giving and giving, and then people don't replenish, at one point you're going to hit empty fuels. And when that happens, it feels like it's hard to feel motivated to do most tasks. And that's where the feelings of guilt going, because some people feel like I'm not giving enough or I'm not doing enough. And it shows how they treat themselves and then how they treat other patients as well. So here's some common symptoms or signs of burnout. And like this is a diagram too of pictures of what it looks like. But so some signs of burnout include prolonged feelings of sadness, helplessness, or hopelessness. So like I was referring to before, people feel like there's no end in sight, feel like they're going to be a caregiver for the foreseeable future. And because of that, that leads to some feelings of feeling trapped, feeling tired even after you're getting plenty of sleep. So there's some people, they say like, I slept the whole night, I rest myself, and I still feel exhausted. Lack of interest in doing things, especially things you enjoy. So for example, some people who in the past love to watch funny movies, if they're feeling burnout, they may not find that same joy anymore to watch those movies because it's just too much and they can't be bothered. Neglecting basic self-care. And I will definitely go into self-care a little bit later, but I'm a big proponent of self-care, and that means making sure you're taking care of yourself and doing little things for yourself. Even it's self-care is as even making sure you eat 3 meals a day. So self-care is very important because it also is going to help you be a better caregiver in that sense. Getting sick more easily with the common cold and flu. And this also goes back to people not following up with their own medical appointments while they're caregivers. So they're more prone to getting sick, or even when they do get sick, not checking in with the doctors to see what's going on with them because they want to focus on their loved ones and making sure they're taken care of. Trouble focusing or concentrating. I notice this a lot more with doctor's appointments, and they're having a hard time absorbing material that's discussed during those appointments. Chronic feelings of anxiety or difficulties relaxing. So some people feel like they're on edge because they're worried for the next shoe to drop, or they're going to be worried about the next crisis, or worried about like they have to run to the doctor to take their loved ones. So it's that constant edge of feeling like you're on edge. um Negative reactions to minor stressors. So for example, if like you have a bad day or someone says the wrong thing, some people tend to lash out. That's the biggest sign. I see people lashing out at others when they get to that point, and little things that trigger. And impatience with the loved ones you're caring. So for example, some people in the beginning, like for example, feeding their loved ones. In the beginning, they don't mind feeding their loved ones, but then as time goes on, they start getting annoyed, and they're like, why do I have to do this? Why can't this person eat? This is not fair. Things of that nature. And you notice that you, like, for example, if you had patients usually wait 30 minutes to help someone get fed, now that patience is shortening. Now, usually, you can only wait 5 minutes before you start getting mad or irritable. And then changes in appetite and sleeping. So that means like eating much more or not eating at all. And sleeping, oftentimes I see people sleep less because there's so much time, there's not as much time in the day. So they feel like they have to catch up at night. Or they're anxious at night because they're worried about what they have to do the next day. So that interferes with sleep patterns and resting as well. And now I'm going to go over in depth some of the coping mechanisms that caregivers can try to implement to help them navigate through the stressors and anxieties I mentioned, and also helping deal with some of the burnout. Um, and these are my main things for coping with stress and burnout, and any encounters caregivers give. And I'll go in detail with some of them in a little bit. But my main themes for coping is prioritizing self-care, which I mentioned before, setting boundaries. I think that's very essential, and I'll go into that too. Communicate needs and ask for help, be present in the moment, and then focusing on what you can control in the situation. So I put this up. It's called a caregiver bills of rights. I find this very important because I feel a lot of times a lot of caregivers get lost in focusing on themselves, and understandably so, because as we're all human, and since are taught that like the person with cancer is the one suffering, they're going through a lot, we have to focus on their needs. But I always bring this up because I feel like it's also important to give yourself permission to take care of yourself. So, and bolded the first two because I feel like those two are very important. But basically, these bills of rights, the first one is I have the right to take care of myself. This is not an act of selfishness. It will give me the capacity to take better care of my relative. And I feel that one is important because you're giving yourself permission to take care of yourself. And by you taking care of yourself, you're going to be a better caregiver and a better person because your needs are being met. And when your needs are met, you're going to be able to fulfill other people's needs. Another one that stuck out to me is to seek help from others, even though my relative may object. So I know some people, expect some cancer patients, they're very sensitive about who they want to see them vulnerable. Because when you have cancer, you are helpless in that situation, and you and forces you to be vulnerable, and not everyone's comfortable having people see them in that state. So it's very important that you have to ask for help, and also, and I'll go into that a little bit more, and communicating that you need that help to your the people you love that you're taking care of, and also recognizing your limits and your strength. So I always say all caregivers, no matter long distance, local, no matter what you're doing, you're strong people, because what you do And I think there was a study, I'm not sure which study, but I know they said that cancer caregivers experience like 3 or times more stress than cancer patients. So the fact what you guys are doing is amazing, and there's a lot of strength in that. But I always say too, in strength, you always also recognize when you need help. So asking for help is also a strength, and it doesn't make you weak. It doesn't make you small because you need help. It helps you by asking for help. You're being vulnerable enough to allow people to help you, and it also helps you be a better caregiver. And then I'm not going to read through all this, but one that's also sticking out to me: to get angry, be depressed, and express other difficult feelings occasionally. So this goes back into people feeling like they can express feelings because they have to seem strong. And I think a lot of the times when you do express your feelings, a lot of people can feel like they relate to you, especially with the your loved one. This is just more like caregivers bill of rights. Um to I think the one that sticks out here is to receive consideration, affection, forgiveness, and acceptance for what I do for my loved one as long as you can. So these are things I feel like are very important for caregivers to remind themselves. And this is part of I also what I say being present in the moment and giving yourself that kindness. Okay. So one of the big things I feel like that helps people cope is the communication component. So I'm going to talk about communication in 3 ways. So this first part of communication is communicating your needs and your loved one needs to like your treatment teams. So I know oftentimes caregivers are actually the ones that have to be the most present and pay the most attention during medical appointments, because a lot of the times people with cancer, they're overwhelmed with everything. Sometimes they block things out just as a way to cope and not deal with things. So usually it's up to the caregiver to be present. So usually I would say with caregivers, and a lot of times too, caregivers are afraid to ask questions, especially with to the doctors, because they feel like they shouldn't, or like that's not their right. But because you're the vessel to absorb that information, communicate. So if you feel like things are not doesn't sound right, or you're not sure how to give proper care, speak up about it. And no question is too big or too small. Make sure you're involved in the treatment plan caring, because the treatment plan caring impacts you too. So like for example, if this is more for advanced stage, but if a doctor says like they think a person is eligible for Keytruda, a lot of the times the doctors will be like, oh, to the cancer patient, how do you feel about this? And they don't ask how the caregiver feels about it, because a lot of people have severe side effects. So that a lot of times has the caregiver feeling like they're not involved. So it's kind of also speaking up and asking your questions. So how's this going to look like for me on my point? Like, what is the care going to be like? And then if you feel like things don't sound right or whatnot, asking for second opinions, asking for questions. And then also too, I know some people, they actually bring another friend or like a family member to care to the appointments, just so in case they're not absorbing everything, they have a partner to absorb that information as well. Communication with your loved ones. And I think this is very important too, because like I said, I feel a lot of times a lot of caregivers hold back 100% how they're feeling due to guilt or not like wanting to hurt the person. But it is important that you express your feelings, especially when things get too much. So making sure you have open conversations with them about their expectations and your expectations as a caregiver. What can you do? What can't you do? Where you might need help. And then also being mindful about the differences and the expectations of being a caregiver and having those conversations. I will say there are a lot of times cancer patients expect their caregivers to do certain things, and then the caregivers think this is what I need to do and that's enough. So then there's that discourse and that disconnect, and that's how resentment builds, because they're not having that communication about expectations. So I always think it's very important to have those conversations about what do you expect from me as a caregiver? And then what is realistic for me to be your caregiver, and having those conversations. And Also, remembering how your relationship was before your cancer diagnosis. So, a relationship will drastically change because of the cancer diagnosis, because different feelings come into play. But it's also, and this is part of being present, it's also remembering who you guys were before then and how you guys can grow during this experience, and being honest about your feelings with your loved ones. So if you're having a rough day, communicating that. If you're feeling that this may be too much, like I was saying earlier, communicating that as well. And also, and I'll talk about this in the next slide, giving your loved one the space to talk about their feelings if they're having a hard time. And then admitting when it's time that you need help, and and kind of outlining, this is what I need help with. Does this work for you? And I'm talking a little bit too about providing the emotional support and what it looks like. I know some caregivers, understandably so, get caught up sometimes with focusing on the physical needs because that's something that makes them feel in control. So if they're if like let's say they're doing the ADL functions, like taking care of them, making sure they're doing their doctor's appointment, that makes them feel like they're doing something. And oftentimes I find people with cancer, they just want an outlet to talk with boundaries, of course. But I always say with this, if you feel like you are at the capacity to hear some of the emotional concerns, I would say encourage your loved ones to talk about like any decisions or things that are on their minds. Listen to them if they're expressing that they're scared. And also being okay with, you may not have the answers to everything, because we don't, sometimes you don't know. And that's okay. Admitting you don't know is, but it's saying like, I don't know, but I hear you. I can understand. Having, validating their feelings, offering support. And even if it means suggesting, why don't you explore a support group? Why don't you explore counseling? Letting them know that they don't have to do this alone. And even if you disagree with some of their wishes, also respecting their decision to choose. So if they feel like, for example, if they don't want to do a treatment or they're not feeling for doing XYZ, talking to them about why they feel that way and coming to a conclusion together. And like I mentioned earlier, talking to your loved ones about their fears. Okay. Other supports is reaching out for support, like I was mentioning earlier, how support looks like, counseling, group counseling, which you guys are part of, like participating support groups, which are very helpful, and then peer matching, which means like that one-on-one peer support. Okay, so, and I mentioned earlier about boundaries, and boundaries is, I think, honest is one of the most important thing as a caregiver that people need to enforce more, only because with you enforcing boundaries for yourself, you're giving yourself little breaks. So part of the boundaries is scheduling breaks for yourself, giving time for yourself, also creating a routine and schedule and sticking to it. So usually some people have like scheduled like in the morning, all doctor's appointments. And then I would say in the afternoon, you tell your loved one, this is my time for me to either go on errands, go for a walk, doing self-care. Also taking time for yourself and to do your personal things. Delegating tasks to people if you need be. And then encouraging your loved ones of your independence in the sense that like if you need to tell someone that I need some time for myself, even if the feelings of guilt come, stressing that you need that time for you and giving yourself that space. Another coping intervention I always encourage is self-care. And self-care looks different to different people. Some people find self-care just like I said, eating 3 meals a day, staying active, going, making sure you're sleeping, keeping up to date with just going to your doctor's appointments, saying yes to yourself, giving yourself the permission to either be upset, giving yourself the permission to go out and do something for yourself. And I don't know if you can see here, it just gives a couple examples of self-care, like time alone, meditation, yoga. I'll go over some more in the next slide. Being kind to yourself, managing your stress, scheduling, things of that nature. And then here's some self-care activities some patients found helpful. Positive affirmations. So telling yourself like, I can do this. I'm strong. I have this. Things of that nature. Some people find that helpful because they find it motivating, especially when they're feeling unmotivated. Reading a book. taking a hot shower or a bath, treating yourself to something nice, um, securing yourself in a warm blanket, making a vision board, like lighting candles, watching something that makes you laugh, listening to music. Some people what I encourage them to do is have like a playlist. Some people have like a playlist for when they're feeling sad. They have some playlists if they need something to bump them up and energize them, like kind of like a workout playlist. So things of that nature. And taking a walk. I know a lot of people find that helpful, just going outside and getting fresh air and having that you time. Some relaxation techniques, and I'm going to go more in depth with about that in the next slide. But some relaxing techniques look like deep breathing exercises, meditation, guided imagery, and then mindfulness. So I have an example of some like mindfulness breathing exercises. One this the tapping method is more for anxiety a lot of people use, but I'm going to demonstrate what it looks like. So I always tell people you tap 10 times in your forehead, 10 times on your nose, 10 times under your chin, and then 10 times either under your armpit or in your stomach, and then repeat and doing deep breathing exercises. I usually tell people to do this if they feel like their back is against the wall or they need to like feel grounded. So that's an exercise that some people find helpful. Another exercise that I like is called guided imagery, and it's you imagine yourself in your favorite place. I just use a beach. I'm gonna use a beach as a reference. So closing your eyes and imagining what you're on the beach and imagining the little details you see like on a beach. So like what do you see? What do you smell? What do you hear? And slowly talking yourself and walking yourself while you're in the beach. Um, Another exercise I have is called color breathing. So it's imagining yourself breathing in and out color. So, for example, if you breathe in, you imagine yourself breathing in like a color red. And then when you're exhaling, you imagine yourself breathing in color like purple or blue. Some people find it helpful to stick with one color. Some people like two different colors. So that's something, and it helps you practice on you having like a steady breath. And sometimes people find it hard to kind of self um guide themselves. So I also included some apps like Headspace, Calm, UCLA Mindful, or Insight Timer. A lot of people find those apps helpful. There's also a lot of YouTube videos that have like guided meditation. So I included one here so you can also refer to that as well. Just sometimes if you just need to hear the voice and you because sometimes when people try to do it themselves, they have so much stuff going on in their head. So sometimes it's good to have like that guided version. And this is called the somatic grounding technique. This is another one if you feel like your back is against the wall and kind of like to help you feel centered and present. And the thing is like name 5 things you see, take a deep breath, name 4 things you hear, take a deep breath, name 3 things you smell, take a deep breath, name 2 things you taste, take a deep breath, and then name 1 thing you can touch and take a deep breath and repeat as needed. Okay. So I spoke about a lot of the stressors and like the emotional toll of caregiving, but there are also a lot of rewards for caregiving and a lot of value in caregiving. So being a caregiver can help inspire your sense of purpose or meaning. So helping someone through this, and having cancer and going through cancer is a very traumatic experience. So by you being a source of comfort for someone you love, that can give a sense of fulfillment. And you're knowing that you are there for someone during their darkest hour, which is can be fulfilling for some. Helping build deeper connections with loved ones. While sometimes caregiving can create feelings of isolation or resentment, it also helps form bonds. Because you're spending so much time with your loved ones, you're getting to see them in a new light. And especially since they're more vulnerable, it gives that time for people to let their walls down and form those bonds in communication and improve understanding of needs. And this goes back into that communication component. By you being a caregiver, you are more understanding and perceptive of someone's needs. And vice versa, that person can also be perceptive of your needs because you guys are both helping each other out. And then clear priorities. I would say being a caregiver too also brings a lot to the forefront about what is important in life and not taking people for granted. So I think by being a caregiver too, it helps put a lot of things in perspective. And like, for example, I have a patient, she used to work a lot. And then after she became a caregiver for her mom, now she's focusing more on taking time, not only to take care of her mom, but also taking care of herself. And she is not working as much. And she's happier because of it, because she started prioritizing things that are important in her life, like quality times with not only herself, but with her loved ones. Okay. So this will be the time for any questions people may have.